want to remind people the Great American Smokeout is this Thursday. It's an annual event that encourages people to stop using tobacco for at least one day, organized by the American Cancer Society. But again, today we are discussing the importance of smoking cessation ahead of surgery. And joining us now is Toni Huddleston, a registered nurse who specializes in surgical site infection prevention. How are you doing, Miss Toni?
I'm good. How are you?
I am doing well. So tell us a little bit about your role so that our viewers know.
So one thing that I do is I monitor for surgical site infections, and I'll follow those patients, and I just kind of look at processes and ways that we can prevent a surgical site infection. There's 122 ways, and one of those is smoking cessation.
Now, when it comes to smoking cessation, what is it that you're seeing?
Typically, whenever a patient comes in to have a surgery and they're a smoker, you can see a longer stay in the hospital, a longer recovery period, and pretty much a double increased risk for developing a surgical site infection.
Oh, okay. And then not only that, too, what about readmission?
It also increases your risk for being readmitted because, you know, it weakens your immune system, so you're at a risk for developing any kind of infection, thus being readmitted.
And we do have some more, there we are, weakens your immune system. And then talk about the chemicals in the smoke. What happens there?
So the chemicals reduce the oxygen and the nutrients that is delivered to your wound, causing delayed wound healing, leading to an infection.
Okay, and also increasing the chances of pneumonia as well, which you just mentioned. So tell us how we can reduce our risk.
So reducing your risk, typically it's recommended to stop smoking well before surgery. Your surgeon will instruct you on how long to quit. Typically 6 weeks is good. It's kind of like preparing for a race. You're not going to show up on race day without training. So you're trying to get your body optimized and the healthiest that you can do.
Oh, okay. And then, of course, there's one important number that you want to share with us. Tell us about that.
There's also a resource you can call. It's 1-800-QUIT-NOW, and you can speak to a free counselor about quitting smoking.
All right. Well, thank you so much, Toni, for joining us this afternoon.
Thank you.